A new study revealing that nearly 1 in 5 Chicago residents who sent blood spot samples to Northwestern University tested positive for COVID-19.
Staggering numbers. That finding is much higher than scientists expected. Dr. Elizabeth McNally, from Northwestern University Feinberg School of Medicine, was part of that study. She joins us now to discuss what she found. Dr. McNally, thanks for being here.
Happy to be here.
Tell us first how this study worked. It started in late June, and you took a pool of what was it, 3,000 residents?
Well, we have many still in progress, so let's say that. We've analyzed about 1,600 at this point. We started by actually trying to survey about 10 zip codes across Chicago, and we chose them because they had different rates of COVID positivity. And what we're looking for with our test is actually, did you develop antibodies? We knew very early on in this process, our testing wasn't really all that well able to, many people couldn't access it, let's put it this way. So we knew lots of people were getting exposed to this virus, and many of them not even knowing that they had it. So the next best way to look at whether you have been exposed in the past is to ask whether you've developed antibodies. And so we set up a very sensitive, very specific antibody test to test whether a person has antibodies. And the cool part about this is we did it by just doing a finger prick. So you can just do a finger prick and put it on a little card, and that card can come back to us in the mail. And then we can do a very, very specific test here in the laboratory to measure how much antibodies are present. We also thought, well, probably a lot of people don't really want to come out of the house to come and give us a blood sample. So that was the real reason why we set up the blood spots.
What have you been able to determine so far about what parts of the city had higher infection rates?
Well, so that's still an analysis that's very much ongoing. What we can say in aggregate, as we've looked at these first sets of samples coming in, is that it looks like we're just under 20% having antibodies to the COVID-19 virus. And so that's a little higher than we expected to get. Some other surveys, for example, are at Northwestern Medicine, our hospital. We did a survey of healthcare workers, and that number was under 5%. And so we think some of that difference is actually the sensitivity of the test that we're using.
Dr. McNally, your study isn't even complete, and you felt the need to get this information out there already. What's it mean to you when you discovered that 1 in 5 people are testing positive for the antibodies, which means they've had it and apparently didn't know it?
Yeah, well, we suspected that part because if you look very early on, there's been a lot of data that especially young people can have this, get over it, and not even know they ever had it. And so then they're really in the position to spread this, and that's the concern. And so really a big part of what we want to do now is this first part of this study is we'd like to expand. And so we hope to cover a lot more of Chicago and even into Cook County that is not Chicago. And we hope to actually get a bigger number and look at what's happening over time. We're also really hopeful that the people who've participated with us so far will want to do that again and let us know in 3 or 6 months how they're doing, whether they still have antibodies and what their health status has been. Correlating antibodies with what your health status has been is going to be critically important for understanding whether these antibodies actually protect us in the future. The other piece we did is we actually looked at what happens in households. So if a person tested positive for the virus itself, what happened to their household members? And there we're seeing it's a very high rate of people in the household developing antibodies, meaning they've had exposure too. So that's about 80%.
Yeah. Which I bet you also suspected, right? All under one roof.
Well, again, we have all been worried about this, and so this is actually some of the first evidence that that's true.
Answering some critical questions there. Thank you so much, Dr. Elizabeth McNally from Northwestern's Feinberg School of Medicine.
Be well.